Good morning and welcome. I'm Dr. Hal Blatman. I'm here today with
Shauna Elbiser, how are you?
and and Sean and I. We've worked together for a number of years. Sean is a nurse, very familiar with pain. We're going to have a discussion today about pelvic pain. And welcome to you. And hope you enjoy this and learn from it. We were just talking just a couple minutes ago about how pelvic pain starts at childbirth.
Yes. If you get to go the natural route, whether you have the epidural or not, there is pain that you will feel hours to days and even weeks, months, and years later.
hmm And some women have pain for years after childbirth and attribute that pain to the childbirth injury. Um, some women don't develop pelvic pain till they're teenagers, and it's menstrual cramps and menstrual pain. So we can talk about that. And then we have pelvic pain that maybe starts with childbirth, maybe doesn't start with childbirth, but has something to do with injuries that happen in other ways. We start to injure our thighs and our pelvis when we start jumping down the steps as children, when we bicycle, when we run, when we land in an unfortunate way on the parallel bars or I-beam or however that goes. What kind of injuries do you see, Shauna, with when you think about pelvic pain?
Personal experiences, you did mention a couple, those misfortunate slips off the bicycle. I remember when you said jumping down the stairs, some folks jump up the stairs as an exercise.
Mhm.
My oldest was just doing that yesterday while I was at work. He was, just jumping up the stairs while I was cleaning up, and he kind of like tumbled back. I would say probably my biggest sources of injury to my bottom outside of having four babies would have been I spent many weekends roller skating and falling on my bottom on the
Mm.
roller rink floor.
And I didn't even mention falling on your tailbone pain. That's a big one too. So, when women and men, because this is both, have pelvic pain, men often get diagnosed as prostatitis. Women often get diagnosed as interstitial cystitis because sometimes it starts with burning when we urinate. What are some of the other diagnostic words that get jumbled into this pelvic pain mess?
Um, I would say a lot of times, honestly, doctors sometimes just kind of even write it off. I mean, if I'm talking about like from an internal hospital standpoint, unless they can actually like pinpoint a diagnosis that they can intervene with, they usually just, push that patient to go see someone, some specialist outside, whether it's a female doctor or a pain doctor. But, you see things, especially with, certain other diagnoses or reasons people come to the hospital. They might, say, oh, well, you have pelvic inflammatory disease, or um, trying to think.
Pelvic inflammatory disease, while you bring that up, that actually was my start in the whole concept of pelvic pain. I was working in this clinic and it was a Sunday morning and this woman came in with pelvic pain. And her story didn't fit, but her physical exam was intense pelvic tenderness. And everything in my book said this is a pelvic inflammatory disease. Intravenous gets started, ambulance gets called, and you're on your way to the hospital. But her story didn't fit, and she was about, 15, 20 years my senior, and I looked like Dookie Howser in those days. So I looked at her, and I always scratch my head, and if I had overalls, I'd adjust them too whenever things really don't fit. And I said, instead of a pelvic exam and starting an IV and calling the ambulance, do you mind if we just stretch out the muscles in your belly? And I had been given a monograph, 30 some pages by Dr. Janet Travell, a few weeks before by a medical director of the urgent care I was working for. And I went into the book bag, my little office there, and I opened this thing up and turned to the page on pelvic pain. And it had diagrams of how to stretch a person out and a diagram of what the pain pattern should look like. And so I laid that out on the table, and she got up on the exam table, and I'm like looking at the pictures because I've never done this before. And I'm moving her body like what the arrows said on the pictures. It took about 5 minutes, and all of her pain was gone. And this abdomen that was extremely tender, especially below the belly button, was totally nothing. Soft, not tender. Now I'm really scratching my head and adjusting my overballs. I'd never seen anything like this before. And I don't believe anything I can't touch and feel. So I got permission to call her back in a week. I called her back in a week. The pain was still gone. So I read the rest of the article. And I learned that every muscle in the body can generate a pain pattern. And then as you and I were working together, we came across the idea that, well, maybe all of our pain comes from that. And indeed, 80% of the information that comes to our brain from our periphery, arms, legs, whatever's outside of the brain, 80% of that information comes from nerve endings in between the cords, strings of fascia that go through our body and hold it together. The nerve endings in between these strings provide 80% of the information that comes to our brain. And most of what's in pain is the distortion in our fascia that those nerve endings pick up. And how do we find those in our patients?
Well, you have to do a thorough physical exam, and
Right.
where yeah, and where you always differentiated that from other orthopedics or doctors that I've worked with over the years is you don't just look at how the body moves and focus on your joints and a painful nerve test. You actually touch the body, touch the muscle, touch the fascia, and see where those individuals actually experience the most pain based on where you're touching.
Exactly. So what we learned as we were working together is that you can't believe what you feel. You really can only believe where you're tender. And so for the person in pelvic pain, if we're looking to find the source of the pain, after you know about your bladder, after you know about whether you have a fractured tailbone and other things like that, the next step is to find out where you're tender. And a lot of folks with pelvic pain, their tenderness is going to be the muscles on the inside of their thighs, the muscles on their buttocks, and the areas where those muscles attach. So we started to make an analogy so everybody can touch their neck. And so if you try yourself, you can grab hold of this big muscle that runs right down here in the front of your neck, get a big bite of it, and most everybody can feel as they come across this muscle that there's tight, ropey, tender ropes inside that muscle. And you also can feel that some of them, somewhere along this line, are way more tender than you ever expected them to be. Well, those kinks in these diagrams, like the one I had with that pelvic pain person way back when, make this pain pattern. And how did you get these? Feel the top of your collarbone, not the front, but push in on your neck muscle and feel and push down on the top, and you'll feel these differences in texture that are also surprisingly tender. And this is the injury that causes that. How'd you get this injury? It might have been nursery school when somebody came up behind you and pushed you down and shoved your neck back and tore, where these collagen fibers attach and weave to the cover over this bone. And you wear that around now, remnants of that injury with this tenderness and these ropey bands. Same thing happens in the pelvis. Where do we find them, Shauna? I'm going to find the picture while you talk.
So if we're talking about where we would touch on those, well, one, you do begin to squeeze those inner thigh muscles, um, and then you can generally those are tender for individuals that are complaining of that severe pelvic or, lower abdominal pain. But also, just feeling around, your pubic bones, and even around like the buttocks, kind of working your way up to, you know, your rectum. You can feel that just intense, you're feeling the changes in the muscle and the fascia, and the patient saying, yes, 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 that's exactly where it hurts.
And here's a diagram that we refer to, this one right up here in the corner, how the muscle that we call adductors on the inside of the thigh send pain that to us is going to feel like it's in our bladder or feel like it's in our prostate. And then the muscles that you were just talking about, that's everything that attaches to these bones of the pelvic floor. And just like this clavicle was tender, you need to go down, feel your pubic symphysis, and feel those bones as they go back toward your sit bone. And if those are tender, those are the attachments, just like this, that were injured when you landed jumping down the stairs, or when you landed off your bicycle, or God knows what other, or the tear from the inside during delivery and childbirth. And men, except for the childbirth thing, it's not any different. Only oftentimes we don't get the bladder symptoms, we get things that we attribute to prostate. And so if you've been working on this for a long time and you've had pain for a long time, and your pelvic floor therapist is helpful, and every time you get your muscles stretched out, your pain gets better, and then it keeps coming back. So really, you end up in this cycle of how do you survive, right? And you go in between your therapy appointments, and they get you back in shape so that you can go and wait another couple weeks till the pain's bad enough to go get some more treatment. And what needs to happen is that these knots and cords in your muscles need to be more ignorable. And these injuries where you hold together, your body needs to repair them. And the problem is that your body has no idea that it didn't repair you the first time, and the second time, and the 100th time. But if you're still tender, that means your body didn't repair you enough. And just like this is tender, and perhaps you have no clue, there are other parts in your body that are tender that you have no clue about. So when you go to heal the wounds that have given you a lifetime of pelvic pain, it's not about being 100% perfect and 100% restored. Really, all you need to do is restore everything to where it's 99% ignorable, just like this, and just like other places in your body that would be tender, but you don't actually walk around with them. So, Shauna, let's just talk for 2 or 3 minutes before we end. Give folks an idea of how do we make it go away once we find out where you're tender and we find out where the pain comes from. How do we get your body to heal?
Well, it's kind of a multi-layered experience. There's, the greatest success when you take all of the knowledge and the science that Dr. Blatman would give you, as far as, ways not only that you can heal that pain, whether we're using regenerative medicine like, PRPs and other, like stem cell factors that can help your body actually heal, and know that it did it incompletely. We create a small new injury and place those parts there so that it can kind of give your body a little bit of assist in building new healthy, anchoring fascia, things of that nature. But also, if you want to get it ignorable, you have to take into account that this means you can't have Mountain Dew and you can't smoke your cigarettes, because those are, toxic to our bodies, and it's going to create just an overall general higher level of inflammation. So if you already have those injuries, you're just going, you're going to put the spotlight on it. when you pack your body full of, you know, bad
Right.
food. Your body uses.
Exactly. And that's so important. There's a few basic things that need to happen for a person to heal. The physical trauma and the engineering failures of our body to hold itself together from those traumas, that's mostly ignored because you go to your doctor and you're going to get a drug and medicine to help make your brain ignore all these injuries. And then you need to change your food, change what the environmental toxins and poisons are doing to you. And all those parts are part of your biology to try and restore itself. And so, if you're really going to work on this pain, all of that needs to be taken into account. And then, God knows what's been going on in your head for the last how many years that you've had this pain. Um, can't ignore mind, body, spirit, and what goes on with that. So, we look at a whole biologic restoration to deal with all these facets of pain. But most important, and really what I think is most important, is the physical injuries that nobody else has identified and nobody really knows how to heal, that your body can't heal by itself and needs extra help for. Well, do you have anything to say in closing, Shauna?
Well, just one small part. You say that the doctors will give you medicine and things like that to make you kind of ignore it. I've not met one chronic pain person that just with traditional treatment is ever pain free.
Mm,
No
that's
amount
true.
that we can give. We increase their neurotin, we increase their pain medicine to maybe a different type or maybe to a type of patch. And then eventually we get to a point where their bodies feel and they can't handle it, whether it's age or some other change. So really, I people can tend to get a little overwhelmed with the idea of, I've got to cut all of this stuff out of my, diet or my lifestyle. Um, but it really is the best shot you've got, and it's in your hands because there's a certain point where the doctors are like, that's it, I give up. There's nothing else I can do. This is just kind of where you're gonna have to settle. And don't settle for pain.
And when they get to the point where it's time to settle, usually that next step is surgery to deal with a nerve that we think is causing the pain. And I really want to underscore that. If you think your pain is pudendal neuralgia, if you think your pain is coming from a nerve, as long as these muscles are tender, as long as these attachments to where the bones are tender, there is no way you can convince me that it's coming from a nerve, and you shouldn't be able to convince yourself. Your real answer is to make the things that are tender less tender so you can ignore them also and realize that they create collectively, all these injuries create a pain pattern in your body. And you need to eliminate enough of that so that the collective becomes ignorable. All right. Hal Blatman, Dr. Hal Blatman, based in Cincinnati, Ohio, offices in Manhattan. And I'm here with Shauna Elbiser. Shauna, tell us just a little bit about yourself.
So I've been a nurse for a little over 10 years now. I've worked in specialty surgeries, like transplant at University of Cincinnati Hospital for almost 5 years. Then I came to work with Hal for about 3 years. I went back into acute care medicine because I had learned all of this information. I was like, man, these are the people that need it. So I worked in the float pool for the St. Elizabeth hospitals in Northern Kentucky. And then last fall, I started teaching high school for the Ignite Institute in their pre-nursing college pathway. And I still, I love nursing. I'm meant to be a nurse, and I don't think I can teach nursing without still having my hands in it. So I still work at one of the St. Elizabeth hospitals. I'm on the pulmonology unit in Edgewood, which quickly becomes the rule out COVID unit. So, and anything else that we do a lot of wounds actually. So you get a lot of the folks that have these uh, wounds, either it's a diabetic ulcer or a vascular ulcer, and then all the pain that comes with those, and the amputations and things of that nature. So yeah, that's where
That's
I spend
awesome.
my time.
Well, thanks very much for joining with us today, and have a wonderful day. And we'll talk next time.
My pleasure. Take care.
Bye now.